Hey there, I'm John Hayes, and thanks for joining us for this episode of the Founders Trust podcast. I had an opportunity to sit down with Cathy Kenworthy, an experienced founder, investor, and advisor in Chicago's healthcare ecosystem. Cathy's someone I've looked to as a role model and a mentor in the course of my own journey as a founder, and I'm honored that she took some time out of her busy schedule to join our show. Cathy and I discuss her approach to planning a product launch, some thoughts on sourcing feedback from early adopters, and her perspective on the future of medtech. So this is one episode where you definitely want to listen all the way through. And as always, stick around to the end of the episode for a free giveaway of an email sequence that you can take and use to help generate some buzz around your own product launch. So let's jump right in. Today's Startup Spotlight is brought to you by Savier. Savier takes a personalized approach to helping entrepreneurs create a clear path to growth. Through knowledge, coaching, and marketing services, Savier helps entrepreneurs and small business owners apply marketing to achieve their business goals. At Savier, our goal is to empower entrepreneurs to achieve marketing success. Check them out at Savier, that's savvyeur.com today. Hey everyone, thanks for joining us for another episode of the Founders Trust podcast. I am so excited for our episode today. We have a tremendous guest, someone I respect incredibly and has been a tremendous mentor and person I've looked up to in my entrepreneurship journey. We connected at the Founder Institute. I'm very excited to introduce Cathy Kenworthy, the founder of Health Hippo, a serial entrepreneur, just an overall badass, ice in her veins. Watching Cathy pitch every week to the Founder Institute I just felt like I was learning so much about poise, presence, delivery. So excited to have Cathy on today to talk a little bit more about launching products, some of her board work, and things she's working on. Cathy, thanks so much for joining us for today's episode.
Oh my gosh, John, thank you. That was a lovely intro and all that respect right back at you. It was exciting to get your note and to be able to join you today. So thank you.
Absolutely. Well, honestly, Cathy, let's just jump right in. Tell us a little bit more about your journey into the world of entrepreneurship and what led you down the path to where you are today, you know, as the founder of Health Hippo, serving as a board member for different organizations, and overall just doing some great work.
John, thanks. I sometimes tease that I'm in the business world, I'm like the Benjamin Button going in reverse, if you remember that movie. So a lot of my career has actually been in very large companies. So I was in investment banking. I worked at McKinsey & Company for years. I had the great, fortune to be able to work at big companies like General Electric, JP Morgan Chase, Bank of America, Cardinal Health. And I would say even in all of those situations, I was kind of always the restless skunk works kind of person who would see a gap and see an opportunity and wanted to be the person to take action, wanted to be the person to create a different solution to solve a problem or an opportunity that I might see. I was recruited to become originally the COO and then the CEO of a worksite wellness company called Interactive Health. And I did that for almost half a dozen years. I took that company through a very large private equity transaction that was very successful and stayed on for a few years to help stabilize after that, and then came out of that in early 2018. Right at that same time, became an empty nester. So my husband and I have 3 great young men who are off in the world. And, it really gave me a chance to kind of step back and think about what I wanted to do next. And I kind of bounced around with a few different ideas, but I definitely have become enamored of both my own entrepreneurial pursuits that you and I know of through our work together at the Founder Institute, but also, work that I'm able to do with smaller organizations in, nowhere near the size or scale of JP Morgan Chase or Bank of America, but or Cardinal Health or any of the others. But the ability to have a lot of proximity to the frontline customer problem that's being addressed, and have the ability to apply my own personal effort towards the resolution of those issues has been really exciting and something that I'm getting a lot of excitement out of, even though, as I say, it's a little bit of a Benjamin Button in reverse, if you will.
Well, certainly better late than never, right? And I know we're all certainly glad that you decided to jump into entrepreneurship as strongly as you did, and gave us a great opportunity to learn more about kind of what you're aspiring to on the entrepreneurial side. What are you really up to in terms of your continued involvement, either with Health Hippo or with some of your board work? Tell us a little bit more about kind of what your current projects are.
Sure. So Health Hippo, as you know from our work together at the Founder Institute, is a company I'm starting that is focused on solving the problem of poor information for consumers in healthcare. And so the core idea is that within 10 minutes, if you are somebody who has subscribed to Health Hippo as a consumer, you can get structured, vetted, quality information about a particular health condition. So be that hypertension, be that anemia, be that appendicitis. And we have a system where we rate information green, yellow, or red. Green is information that's time-tested, proven, well understood to be the state of the art about how a particular condition might be diagnosed, treated, what your prognosis might be, what its cause might be, or yellow for things that are possible but not really proven, and red being those things that people popularly believe but actually are not true. And so there's been a construction of a set of offerings around that. And so that's one of the avenues that I'm spending time, although I will admit through the pandemic, the amount of time I could allocate to Health Hippo got challenged, and I'll come back to that. I also have had the great opportunity to be involved with a number of companies. One is called Conceivabilities, which is focused on the problem of in people who are trying to become parents but are not able to conceive, let's call it naturally, and need the help of a surrogate or egg donor. And so I actually became titled as president of that company, and see a ton of opportunity. That company's been around for 25 years, but is going through a process of kind of reimagining what the future holds, led by the founder and CEO, Nazca Fontes, who's a really also extremely compelling leader and visionary overall, and certainly in that space. I am on the board of a venture fund with Ascension Ventures, which is a very long time healthcare fund. Is really sitting at the intersection of very interesting healthcare innovations, be they devices, services, technology within healthcare. And so that's a very privileged position to be able to see those opportunities and weigh in on investing behind those. I'm actually the operating partner of a private equity company called Periscope Equity, and I sit on the board of one of their portfolio companies called Integrated Behavior Health. I'm on the board of a paint company because that fits right in, and so that's actually been a super interesting and rewarding opportunity to be part of. And then I've got a number of nonprofits that I'm involved in as well.
Well, Cathy, with everything on your plate, I'm just grateful that you've time to carve out a few minutes to speak with us today. So makes me extra grateful for the opportunity to sit down with you. But I mean, honestly, it's so impressive your work, especially in the healthcare space, because you're able to view it and you have seats at the table from different perspectives, right? With Health Hippo, it's the consumer information side, and it's the very relatable experience of having a condition or thinking you may have a condition, not knowing anything about it, trying to learn more about it, trying to, work a way to solve the problem or speak to your doctor about it, which is very relatable for all of us. And then with your work with conceivables and in some of your other positions, you're able to take a look and see how the provider space and the actual administration of healthcare is changing. And as you know better than anyone, it's changing so rapidly right now, especially with large structural changes that COVID will probably impact in the longer term. You just have such a unique perspective on healthcare tech, the evolution. So kind of with that in mind, are there certain things that you think people who are looking to get into healthcare tech from an entrepreneurial perspective or startup perspective should consider before making that type of decision or that type of leap, with everything about the infrastructure, managing those sort of healthcare relationships, the consumer side, et cetera? Are there one or two things that people who are passionate about healthcare entrepreneurship should really think about more deeply as they're starting their journey in that space?
So fabulous question, John. And I certainly don't have the monopoly on that answer. But I think it's interesting because there's kind of a sort of call it the Hatfields and McCoys within healthcare, that there are the sort of tried and true practitioners, providers of healthcare, right? People who maybe spent significant amounts of their own time and money to become educated in and are truly clinical resources within healthcare. And those individuals tend to sit in providers or payers, or sort of, I call it like within the healthcare proper system. And then there's the people who are sort of looking at it, that are not necessarily of healthcare but see other opportunities. Certainly, I'm one of those people. And boy, wouldn't it be better if? And the dynamic there is tricky because on the one hand, there are absolutely staggering complexities in the actual delivery of healthcare that impedes even the best intentioned innovations. And on the other side, there's, I think, sometimes what happens in fields where there is deep subject matter expertise, there can be kind of tunnel vision to be able to even see the larger context for innovation. Atul Gawande is a favorite writer of mine. He's written books and he's written for the New Yorker, but he's also very acclaimed physician who was head of very very large public health organizations and is part of Brigham Women's and very well regarded. And I think one of the few people I see having kind of a line of sight towards both camps, if you will. And he wrote a piece on comparing healthcare delivery to the Cheesecake Factory.
Oh, okay.
And it's sort of a fascinating idea that there's lots of outlets of Cheesecake Factory, and there's a certain expectation of what you're going to receive, and what is it that allows for that, and trying to take some of those ideas and apply them within healthcare. And I was sitting with a group of colleagues who were so in healthcare, who were so deeply offended by this even possible comparison between what they do and the Cheesecake Factory, even the entertaining of that concept. And so it's you just have to go into it with deep regard for the fact that the things, for those of us, John, like you and I, who have not spent decades training and educating ourselves to be in that field, need to sort of understand and appreciate how challenging, and especially at time of COVID, how challenging that front line is. But on the other hand, also have deep regard and interest in challenging some of that conventional wisdom that I think is very much at play. And of course, unfortunately, we all, including healthcare providers, have our own war stories of where healthcare goes wrong. And what brought me to Health Hippo is I certainly believe that a substantively informed consumer who actually is operating with at least the basics of understanding about the health concern that they might have is going to be able to be, a much more effective consumer of these services, and be a much more effective decision maker along with care providers. And that's, to me, that's if there was one bet I wanted to make in healthcare, that's the thing that I'm absolutely determined to make progress on.
Well, it certainly seems, as you just pointed out, if you have a more informed patient, they're a more, in quotes, effective patient, right? They're easier to treat, or you can treat those things more directly. So that also leads to some sort of efficiency in the system, right? You're not having to see maybe 3 different specialists because you're able to understand maybe more of your symptoms at a more comprehensive level. You're able to speak with your primary care physician about that, and then connect with the right specialist the first time, as opposed to maybe the 3rd or 4th time, right? So it would certainly seem to contribute to efficiencies in the system. And obviously, everyone speaks about rising costs, and that would appear to contribute towards lowering costs in similar ways, and at least for certain conditions.
I totally agree. I mean, I call it sort of twofer, things that lead to more effective outcomes as well as more efficient outcomes, to your point. And, it's not just the cost, to use your example of going for, several different opinions. And the part of the person who's doing it, it's time, people, we know that there's terrible inequities in the healthcare system. Not everybody's going to have access to being able to gather all those opinions. And so, I feel like this kind of holy grail in healthcare has been this, bumper sticker called consumerism. But there is no consumerism if there isn't shared decision making, and there is no shared decision making if there's enormous inequities in the information that a consumer has. And as you know, in the work I did at Founder Institute, the disparity in terms of the amount of information that a consumer would have to make what all of us would regard as one of the most expensive and consequential kinds of decisions that we'll make with regard to almost any healthcare intervention, as compared to the information you might have when you buy a car, buy a refrigerator, make almost any other consequential decision in your life, a house, spouse, whatever. You're operating with such limited information, and so much of the quote unquote free information is provided by resources like WebMD and hospital provided websites like Mayo and Cleveland Clinic. And so much of that information, when you really examine it, is conditioned on being slightly alarmist, slightly oriented towards getting you to click on the ad, make an appointment, take a particular action, rather than truly being informative about what is actually known on that topic. And so it's astonishing for something that's 20% of the U.S. economy, that there's still these kinds of barriers to consumers getting the information that they really need.
Absolutely, and large structural barriers, right? As you pointed out. So, Cathy, Health Hippo, as we just kind of laid out, certainly was not a small undertaking, right? It was an ambitious mission. It was ambitious to go up against kind of WebMD, Mayo Clinic, some of these other large information sites that obviously have a lot of credibility built in. And you attempted to do so anyway and have done so very successfully, right? And so I remember I was very honored to be a part of one of the kind of the founding feedback group that was able to offer some feedback on the platform as you were testing it. But, let's talk a little bit about kind of how you developed the product to get it to a place where you could launch it successfully, to be able to establish a foothold, against the WebMDs of the world. So how did you think about kind of the product development for the Health Hippo platform, and what did that process look like on kind of the platform development side to get it to a place where you felt ready to launch and contribute that value? And because it's sensitive, important medical knowledge, right? That people are searching for in a time and place of vulnerability or concern. So how did you go about the process of developing the platform to get to that point where you felt ready to deliver that information in some form or some format to consumers?
So you're just going with the easy questions today, is that right? Well, I mean, I will give credit 1,000 times over to the structure of the Founder Institute to really break down that big, enormous question. And it was absolutely, for me, the structure of the program that helped me take this from, to your point, a admittedly very ambitious concept that I had a few glimmers of what I thought would work, but really break it down and do it in a way that the Founder Institute absolutely, and for all kinds of good reasons, insists on embedding other human beings, other quote unquote possible customers to, be at every step of that product development phase. And so whether it was me learning how to use, the Amazon market research capabilities, whether it was, I think you and I had a colleague in the Founder Institute who actually, no kidding, put on a sandwich board and stood in the middle of Millennium Park and asked strangers, to give him input. And I did things kind of not too far away from that. I didn't actually myself assume a sandwich board, but kind of accost almost anybody who would talk to me about it. And from that, I began to develop, just kind of definitely my brain is very much around this, using structure as a way to diminish the complexity of the information, and using visual design as a way to engage people in the information so that it's not, these are sensitive and serious matters, as you mentioned, and trying to come up with visual designs that would cue people to not unnecessarily feel anxious about the information, but be able to engage with it. And then I was lucky enough to be able to tap into a very, very well-regarded UX UI design firm in Chicago called Fuzzy Math, that was willing to work with me and iterate. Of course, we spent a lot of time looking at other exemplars, really mostly outside of healthcare, to conceptualize what the design might look like. I was also very lucky to be able to follow on that work with a couple of projects with a set of students in UX effort that worked with me through a few rounds of focus groups and things like that. And then, I was very, very greedy about just hitting up every friend and family member to ask them to provide feedback. And from all that, eventually I got to something that I felt had the right sort of structure to it. Even then, though, I probably ripped up and changed the structure several times before I got to the point of launch. And right now, I do feel at peace that the layout of it is strong. It may still evolve, but it's got a good structure to it. But I also have, you can call me Dr. Kenworthy, because I secretly went behind physician paywalls and things like that to be able to get the information. And it's, it's dense, it's complex, it's not. And so that definitely is my long pole in the tent, is being able to then take this kind of formula, if you will, for the product, but extend it to a wide enough array of conditions that I've got something that would have even a hope of going up against the WebMDs and the rest of it.
And you touch on sourcing feedback throughout the process. And I know you're very deliberate with your focus groups and in certain ways that you source feedback. But how did you approach kind of incorporating that feedback into your rollout for the launch of Health Hippo? But what I mean by that is, how were you able to take a lot of different opinions? Because that is the one really nice aspect of Health Hippo, is everyone has health concerns, right? And everyone's looking for health information at one point or another about a variety of topics. And so you have a lot of different people with some more or less medical knowledge and comfort with, I guess, medical terminology, offering you feedback, right, on the platform and the information and the presentation. So how were you able to filter through all of that feedback and pick out some of the more helpful or constructive bits that you knew would really help move Health Hippo's progress along, from maybe some of the less helpful, opinions or pieces of feedback that wouldn't be good paths to follow?
So, I think one of the really important learnings, and again, I'm going to say something that sounds so obvious, but to really, one of the things that for me was very new with Health Hippo, this was kind of my baby, right? This was an idea I'd incubated forever, and to put it out into the public domain among people that I care about and people that I didn't know at all, and everything in between, and get just feedback. You've got to harden yourself up a little bit and just take the feedback, right? And that was something I know we talked a lot about during Founder Institute, to kind of quiet the voice that says, well, they just don't understand what I'm trying to do yet. You've got to sort of have the self-control and the humility and the flexibility to kind of quiet that voice. And I think, again, we're in the Founder Institute program, we were all able to be good peers to each other, and people would pull me to the side and say, Cathy, that's the fourth or fifth time you've gotten that same point of feedback. What are we going to do about it, right? And so that kind of process to kind of make sure that you're really tuned in to hearing that. I also, though, I think one of the things I learned, and again, this is something that might in some sense shouldn't be a learning, but it certainly was a learning in the context of like, my own quote unquote baby project like this, that you really can't go into it wanting everybody to be a customer. Not everybody is going to be a customer. If you think that the internet is a good place to get an automated diagnosis, God love you, but that is not Health Hippo, and that will not. I don't even believe in sort of the internet being a basis, or AI is going to create diagnosis. I just don't believe that, and that's not what I'm trying to offer with Health Hippo. So just using that as one example, kind of really trying to distinguish who are consumers that are engaged and interested enough in health and create and have some interest in this kind of information. I won't say qualified feedback, but I do look for, I do try to tune into feedback from the portion of possible customers that I view as kind of the target, and continuing to hone in on, like, at the same time that I was building the product, who is my target customer. I mean, that became the kind of yin yang that I was trying to triangulate in on as I went through the development process.
Absolutely, and that's always kind of the difficult part, right? Is filtering through all the opinions, because a lot of times, you especially if you're dealing with friends and family, they're going to sugarcoat things a little bit, right? They don't want to hurt your feelings. They want to be supportive, but that's not always the best feedback, right?
Although not always. I will tell you, I was close friends and family members who said, Cathy, this is kind of for the birds. I don't know. I mean, maybe they said it a little bit more nicely, but there was critical feedback that I got from people that are, very close. And I was astonished, John, like, if you ask, and if people, I guess, believe you are really asking and really open to feedback. I mean, I would get pages, documents from people with comments and thoughtful critique and questioning. That was very humbling that people would even take the time to do that. And so, but you're right. I mean, there is a balance between trying to make sure, among the people who is there a sugarcoating, or are you really getting the unvarnished truth? Then you've got to try to balance those things.
Well, it sounds like you have some great friends who truly care about you. If they're offering the constructive stuff, right, that doesn't have
Yes.
the on it. So that's certainly great to hear.
Yeah.
Cathy, from your experience either with Health Hippo or your other career experiences, how did you know with this particular product or other ones, when the product development itself was in a place that was ready to go, but that the timing was also right to bring that product or service to the market? Because it does seem like timing plays a key aspect, right, into making sure that where you're differentiated from your competition, you're able to, introduce that in the market when the market's ready for it. You hear a lot of stories about people who launched too early, right? There were social media networks before Facebook, but they obviously hadn't caught on in a certain way or with a certain value prop. So,
yeah,
in your experience, how did you know that the product and timing were right to take Health Hippo or other things you developed to the market when you did?
So, I mean, I guess I'd start by saying I'm not sure the timing is right yet for Health Hippo. So I will start with that. But there's a favorite saying of that I read that Lauren Michaels said about Saturday Night Live. We don't go on because we're ready. We go on because it's 11:30. And I thought that was a very clever way of saying, at least in the feedback and the kind of, as you're searching for product market fit, you at some point you have to put the pencil down and go. And that is absolutely a value that I think is important. There are ways that people are earning revenue, as you and I both know, all over the place, that are not trying to, solve world peace. They just kind of have a way of constructing something that people are willing to pay for. And at some point, you got to put yourself out into the public arena. And you and I both heard over and over and over, and I totally agree with this. Revenue is the cheapest source of capital. So the sooner you put yourself out there and find out, is this idea going to be appealing to somebody? And maybe the somebody is 5 people, maybe the somebody is 10 people, like just a small number of people who say, yeah, I'm willing to give you a credit card for that. That is there's a lot of value in that. Now that to me is different than kind of market timing, which is really your question. And as I was building and launching Health Hippo, of course we had COVID. The amount of health content on the internet, not just about COVID, but about hypertension and almost every health issue you can imagine, exploded by a factor of somewhere between 5 to 10.
Oh wow, that quickly?
Like
just for the last
literally year. No, in the first like 6 weeks of the pandemic. I mean, it was astonishing the amount of publication that was happening with regard to health information. So I'm not actually convinced that like my timing for a true market launch has arrived yet for Health Hippo, and that's something that I'm actively monitoring as to when. And then obviously we've got a larger climate where there's a lot of questioning of science and fact and alternative facts and all that kind of stuff. So I probably am not at my optimal market timing yet, but we will be at some point.
Well, you've touched on both in our episode today and in the past on the grading system, right? The green, yellow, red system, which would appear in my mind to be more valuable than ever to a consumer, because as you mentioned, there's so much more content out there. That doesn't mean it's all good content, right? There's a lot of stuff that hasn't been verified or is more speculative, particularly with respect to COVID-19. So the fact that you have a way for consumers to understand the certain verification levels or certain quality levels of the content that's out there, I would imagine would be quite powerful. So I would certainly hope that plays into your favor with Health Hippo.
It does, and what we do additionally is we take the number of findings that are green or yellow or red for a given health condition, and we actually construct something called a confidence grade for that condition. And so that can be a little bit of a disconnect for people who potentially believe that doctors know everything. Well, the truth of the matter is doctors know, and the medical field as a whole knows a lot more about some conditions as compared to others. Something like appendicitis, which has been described and documented for 100 plus years, that's a very well understood high confidence grade, lots of green findings conditions, although it's not 100%. I mean, there's still interesting things that are being learned about appendicitis. And that sits in contrast with something like COVID, to your point, where the kind of Health Hippo confidence grade around COVID is actually quite low. And that's, the evidence is we're all, quarantined and sheltered in place and all the rest of it. So my kind of joke has been, I'm sorry that the world's had to go through a global pandemic, but it's a great use case for Health Hippo. And obviously that's what matters here. So.
Well, you got to take advantage of the opportunities as they go, right?
Exactly.
So, Cathy, I know, through a variety of product launches in your career, obviously, that a launch is really your brand's first impression, right? And it's a way for you to communicate certain notions, qualities, aspects, character about your brand and what your company does to your customers. So what did you want the first impression of Health Hippo to be? And how have you gone about the process with this company and with other ones of developing your messaging and brand material to really communicate that impression from the day you launch? Because it's not something that necessarily should be happening retrospectively, right? You sort of have to lay the groundwork, even if you don't have the whole plan figured out on launch date. So how have you thought about branding and how that plays into your launch?
Great question. So really, actually, from the very beginnings of the visual design work, we had a couple of kind of values that we held high. Curiosity as an example, and there's a few others like that. Certainly, transparency. Certainly, respectful authority. Another example is I passionately believe that if there's something people really do hold very dear, it's their trust and respect for their primary care physician. Regardless of anything else going on in the world, people do trust their primary care physician. And so making sure that that's part of our way of thinking about this is Health Hippo is not a service to upend that relationship. It's there to help support that relationship. And so even from the beginning, visual design, like what colors we chose and how we spaced information and things of that sort, we were trying to be very attentive to those ideas right from the beginning. Clearly, copywriting is an art, and so how to convey a set of messages. I'm a big fan of thinking about things like Jerry Maguire was one movie, one very popular movie, but the trailers for Jerry Maguire were quite different. If you were a young African American man, possibly your trailer for Jerry Maguire was about, this is a sports movie. For other people, it's a love story. For other people, it's something else. And so trying to create trailers that will connect people to like one movie, One Health Hippo, is something that I think a lot about. And, for many other organizations that I'm involved in as well, and exactly to your point, I mean, there are always moments of truth where people are really going to pressure test and try to understand, well, what does this organization actually stand for? And, it's easy to take, and we're living in an environment where it's easy for people to take the cheap shot, for people to just try to glom onto the news of the day, to affiliate their brand with something else that's kind of, controversial or hard news. And, you should not be afraid to throw punches. As I've described, I think WebMD is a terrible service, and I'm prepared to be pretty pointed about that. But at the same time, your brand has to stand for something. And so being thoughtful about how you try to convey that is certainly not something I've got the magic elixir for, but it's also, I also think, to your point, you should be thinking about it ahead of time, but it is something that your customers are going to help you shape. And so you've got to be available to that and sort of allow that iteration as you get into the market.
I would certainly agree with that. I think it's about kind of establishing your first few building blocks, right? So authenticity, transparency. People know that you're trying to build trust up front, and then not kind of pulling the rug out from underneath them later on. But I certainly agree with you that as customers kind of evolve with your solution and find different ways to use it, it certainly means different things to different people, and you start building kind of that larger mosaic of those meanings, right?
And the elephant in the room for Health Hippo is that many people are accustomed to this information is free. Why should I have to pay for it? And so the real, again, being transparent when we talk about that you're paying for it, how we talk about that, why it is that we're doing that, and connecting that to the transparency and the authenticity of, wouldn't you rather know what is the business model that is sourcing this information for you? There are other good examples where that's happening in journalism, and many other arenas as well. But that clearly is going to be a tall order, and that is unquestionably the big challenge for Health Hippo.
Just as it is for any startup, right? Proving your value, right? Why should I pay for this? Absolutely. So Cathy, from your experience with Health Hippo and throughout your career, are there a few key considerations or pitfalls that you've seen founders and companies fall into in the course of kind of planning and executing a product launch? And what would those couple of things be?
Avoiding revenue. I put that at the top, and you and I know there's a mentor at the Founder Institute who is really focused on this point. It is so easy to get kind of sucked into, I have the answer, and people will pay for it later, rather than dealing upfront with what is that underlying need or problem, not the one that you have in mind, but the one that is in somebody else's mind. Zeroing in on that mind state and really staying connected to that all the time, and connecting to that. Yes, you've got something to build, and you've got a point of view and some passion around what a solution might look like. But exactly to the prior point, if you can't ultimately make that case that person's need is so clear and urgent, that they are willing to open up a pocketbook and spend money on the thing you're building, pretty early, then I would argue that you're really headed down the wrong path. And that is a very again, sounds very basic, but I see people all day long kind of trying to skip past that critical point. And I think that sits at the heart of I don't know, socially minded capitalism, if you will.
Well, and I think a lot of that comes from this balance that founders often have to strike, in that you have to be a rah-rah cheerleader for your idea before it's really in existence, right? Or before there's anything tangible to look to. And you constantly have to overcome a lot of the naysayers, right? And be an advocate for yourself. But then you have to turn that off at some point and focus on, okay, am I building the right solution? And really the greater question is, am I focusing on the right problem, as you pointed out? And so I think sometimes it's difficult for founders to make that switch mentally when it comes time for those key decisions of, are we going down the right path? Are you being your own internal cheerleader and being honest with yourself, as opposed to, trying to be an advocate for yourself in front of a potential partner or investor or key hire, et cetera. And I think that's difficult for people to switch between those dual roles.
No doubt. And even, for, all founders, right? We're probably selling vision more than we are something concrete, but even the construction of that vision and selling a vision, the umbrella of that vision needs to be large enough that it creates the connection to somebody else's need state.
Absolutely.
And that's again, it's a I don't know, there's a billion books have been written on this topic, right? So I mean, it's not a kind of novel discovery, but it's hard, and it's easy to see how in practice, how quickly people can, all of us can get kind of focused on our idea about the better answer.
Absolutely. Well, Cathy, we're going to finish up here with our 3-question grand finale. This is the fun stuff. These are the extra credit questions, right? So, if there's one book or blog or information source you'd recommend founders check out to develop their understanding of really, solving a customer's problem, planning and executing a launch, et cetera, what would that one resource be?
So I am a huge fan of a book that one of the current founders that I work with gave to me, which is called The Hard Thing About the Hard Things.
Okay.
And it's just a really extremely well-written book by Ben Horowitz. And, who's now a very successful VC in Silicon Valley, co-founded Anderson Horowitz, and is, I think, big claim to fame this week is that they're investing now in Clubhouse. So right. Clubhouse is a thing. But, Ben Horowitz wrote this book that is just very gripping, and it's a very compassionate, educational description of what the journey of really going for it, what it really means to be a founder, and how hard the hard things are about that, and how terribly lonely and difficult they can be, but also, just kind of what the grit and determination is that it takes to get through that. And it is so easy to look at, the success stories that abound around us and think, oh, it must have been easy for that person. And I love the way that Ben just kind of, he's arguably looks like one of the most successful entrepreneurs that could have ever been put on this earth, and how raw and vulnerable he is in this book. I mean, there's nothing he holds back, I don't think. And it is just, he really lays it all out there. So I think it's a great resource.
No, I certainly appreciate that. And I've heard of it, but haven't gotten a chance to read it. But certainly will have to add it to my list for this year, because it's, I appreciate the vulnerability that you talk about. And that's it. Entrepreneurship is a roller coaster, right? And anyone who says it's only, like a stock chart up and to the right, which seemingly happens these days, it is not giving you the whole story. So that's a great resource. So appreciate the recommendation. Second question here of our finale: what's one product or company that you're really excited about right now? And just to set some limits, you can't say Health Hippo or Conceivables or any of the stuff you're currently working on.
Oh, goodness. Sorry, does it have to be a new company or just
No,
any
not necessarily
company kicking around?
just
I
any company.
just because I'll just put it out there, like I can't live without Twitter. Honestly, I think Twitter is for sure a lightning rod of all that is good and all that is not good about social media. And yet it is novel. It is different than anything else that's out there. And it has embedded itself in a way, at least for me, of how I acquire information, how I digest what's going on in the world around. And, I liken it to the dawn of the printing press. Way back when the printing press first came online, my guess is there was not nice things that were printed on the printing press. It
Probably not.
became a vehicle for probably some pretty scandalous stuff. But eventually, I have faith in the human condition, and people learned and evolved, and the printing press led to many good things for humanity. And I yet still have that positive belief of whether it is literally Twitter or some derivation of it, that there's something else for us around this explosive change with social media and our ability to communicate that I think is left to go. So that's my one.
Well, I think most of us are right there with you, Cathy. And honestly, just the instantaneous nature of it is really something. I mean, it's totally changed the way I personally digest news. And I know many others have as well. And you see its impact on markets and developments, investments from the VC and startup space. So it really is networking even. So it's really a crazy phenomenon that we still have to harness the power of it, as you mentioned. But
Yeah.
it's certainly transformational. So. All right,
Agreed.
last question here, Cathy, of our 3-question grand finale. But if our listeners wanted to get in touch with you directly to discuss launching a product, your journey as a founder, Health Hippo, Conceivables, your other projects that you're working on, what's the best way for them to get in contact with you?
C Kenworthy at mac.com, MAC. So
Right
I'm happy to, what's that?
Right to the source.
Right to the source. Absolutely. Yeah, no, I'm happy to get notes and I really enjoy, one of the things at this is sort of a newer found, I'm not even sure if I'd yet call it a skill, but something I really enjoy is being able to connect people. And so even if I'm not the person who can provide advice, I might know somebody else who can. And so just, I really enjoy the ability to, and I'm honored by people who want to be connected with me and, my opportunity to connect with others. So.
Absolutely. Well, Cathy, thank you so much for joining us today. This has been an incredible discussion. I know I've personally found it incredibly valuable, and I know our listeners will as well. For more information on all of Cathy's work, please feel free to reach out to her directly or to us at Founders Trust Podcast at markettrust.io. Cathy, thank you again. Can't wait to have you again on the show soon. And best of luck with everything you're currently working on and in the future.
John, thank you so much. It was a lot of fun, and good luck to you as well with the podcast.
Thank you. The most fun part of any product launch is generating a buzz around your new solution. And what's the first thing you can do to start building this excitement about your product? Sharing the news about the launch with your family, friends, supporters, and other people who have been following your journey. Hopefully, you have somewhat of an email list at this point. So today's giveaway is an email sequence you can use to connect with your tribe and build the buzz you need for a successful launch. It starts with the launch date announcement. Here's the deal. Only do this when you know for sure that you will launch on that particular day. Things always go wrong and delays happen. It's Murphy's rule, right? So make sure the speed bumps are out of the way before you publicly announce your launch date. You'll also want to include a clear and concise description of the problem you're solving and how your solution meets that need. Once you're 7 to 14 days out from launch, you'll want to send a pre-traction email. This includes some sort of special incentive or bonus for this list of people who have supported you in your earliest stages. This can be a discount code, a free trial, early access, or some other incentive. But in any case, it helps you build momentum heading into launch day. On your launch date, you'll send out your official launch announcement. So make it as easy as possible for email recipients to navigate from the email itself to your website, landing page, online store, or whatever location you want them to reach. Your primary goal is to push traffic to your site with this email. And finally, you'll want to send a short series of follow-up emails that are segmented for various groups. You'll send one email that'll go to subscribers who didn't open your launch announcement. You'll send another to go to those who did, which is more of a thank you email. And finally, you'll send another to those who actually made a purchase or conversion on launch day to keep engaging with that particular customer or prospect. So let me know what you think. Comment on our social media or send us an email at founderstrustpodcast@markettrust.io. Now go get building.